The number of people affected with this condition living in the UK is going to double over the next 2 decades.
Being able to measure people's Parkinson's within a short period of time is quite difficult. Also, in clinical trials, being able to measure how bad the Parkinson's is also difficult.
What I'm interested in with my research is the prodromal period, where we now estimate it might go back 15 or even 20 years before an individual has got these motor symptoms and their diagnosis of Parkinson's, because of course at that stage there's a lot more to rescue in terms of brain neurons that haven't yet been affected.
We've been using this smartphone app in the Discovery cohort study, which is a study involving people with Parkinson's, people with REM sleep behaviour disorder and healthy controls. And the smartphone test guides people through 7 tasks, which assess voice, balance, gait, as well as reaction time, dexterity, which is finger tapping, rest tremor and postural tremor. And the idea behind all of that is that we can rely on the sensors that are in smartphones to try and accurately measure those different kind of movements, perhaps more consistently than a human rater can. We've been working very closely with a mathematician, and he's extracted 998 statistical features from the 7 tasks. We can then take those different features and feed them into fancy machine learning algorithms and then train those algorithms in order to make predictions. As we collect more and more data, the accuracy of our predictions will improve.
Perhaps there's somebody that's more likely to need a lot of exercise input to prevent early falls, or maybe to prevent early problems with their memory and cognition. And having that information really to sort of bring about long-term lifestyle changes, I think will be really helpful for patients and families, and ultimately for government in terms of reducing costs, given that this condition is only growing exponentially.